In this video, we're going to talk about observing symptoms related to the mouth and taste. Let's start with the big topic when it comes to mouth, teeth. All kids who have PANS or PANDAS flare with loose teeth in the early stages. Eventually, with homeopathic care, we see that they actually can have loose teeth and not have flares. That said, early on, almost all of them have issues related to loose teeth or to dental procedures. So because of that, telling somebody that we have a loose tooth, that can give us indications on how to manage the remedy and how to manage the case, but it's not going to help us with the remedy selection. That said, if there are issues where there's slow dentition or unusual dentition, meaning like that it takes like 6 months for a tooth to actually erupt, or that they're really, really delayed, that can actually be helpful. Changes in the teeth themselves. So if you have like discoloration in certain ways, if the teeth are really brittle or crumble or they turn black or any of those types of things, if there's major issues with dentition or dental work, those are more useful. Just knowing that a kid flares around loose teeth, that's not as useful for selecting a remedy. And that's really what the focus of these videos are on. So I just wanted to say that up front, that the loose teeth are not quite as useful. Dr. Petersons, let's shift gears and talk to a little bit more about the pathologies associated with mouth and taste.
Yeah. So typically with the mouth, we and our kiddos, a lot of them will have cold sores, so little eruptions around the mouth. Cold sores can often get mistaken for impetigo, so pictures are useful, and they tend to be on the outside of the mouth. And then we have canker sores or mouth ulcers that are the sores that happen inside the mouth. Mm-hmm. So those are super useful to know what they are and which one they are, and oftentimes canker sores and cold sores can get confused, and so important to describe it and send a picture if you can. And then the other pathologies of the mouth, certain sensations of the tongue, like having a hair in the mouth or feeling like there's a prick in the tongue, or those types of things. Saliva, increased saliva, decreased saliva,
really
drooling,
thick saliva. Yep.
Thick saliva, bad breath, especially if it has a really specific smell, or coating of the tongue. Different types of coats, or if the tip of the tongue is red or it's furred or covered in white, thick yeast, right? All of that can be potentially relevant. Sometimes we can have deranged taste. That symptom I can't say is as helpful, especially for kiddos, because their taste buds are changing constantly throughout this entire time as they're growing. So their tastes are going to change and evolve. But if there's a strong affinity for a certain taste or a strong aversion to a certain taste, that could be helpful.
Mm-hmm. Loss of taste too, as we touched on in our last video. If there is a loss of taste or an alteration of taste, so not just like a preference we're talking about, but like if peanut butter now tastes like rubber, that is a more useful symptom to give us. And then do you want to touch a little bit on cavities?
Yes, cavities. Again, a lot of our kiddos are prone to that. Knowing if they're on the top, if they're on the bottom, if they're in the molars, if they're in the, like, which part of the tooth they're on, and how prone to them they are. Sometimes cavities are caused from different types of medications and fever suppression and things like that. So it's good to know that they're part of the history, but they're definitely slow to heal or treat in terms of long-term healing, but knowing that they're there is helpful for finding a remedy.
And as always, with all of the things that we've talked about, location, modalities make a difference. So if there's pain, what is the sensation of the pain? What does it, what makes it better? What makes it worse? And location of all of the, sores, exactly where they are in the mouth, that can all make a difference as well. So if you need to review the modalities video, like to the general one, to get some more specifics about anything going on in the mouth, that could be useful.